Okay, so we're going to hear from Sharon, who is, as I said, a postpartum doula on our team. And Sharon's support comes from the heart, and babies and parents can feel that. And we hear this all the time from clients that say, you know, oh, she cares so much about what she does, which is absolutely true. Her favorite food is cookies, and she would eat them all the time if she could, including breakfast. And so at this time of year, I make shortbread cookies, and that is partly to remember my amazing grandma. And I came over yesterday with a plate of cookies, and my sister had some, my daughter had some, I had some. And then when I went into the bedroom, my mom said, "Where's my cookies?" And I had to go home or some. So that's okay though. So she's going to be talking to us about intimacy and pregnancy. So take it away.
I will for sure. Can you hear me? Is everything good? Christy, can you hear me? I don't know if
We can't
anybody,
hear you.
you can hear me? Okay, perfect. All right. Welcome everybody to our Meet the Things with Pregnancy. You never know. It can go so many different ways, but just if you enjoy it, go for it. It's not causing any problems. It's all good. It's all good for you. The other thing is the physical changes. And so sometimes when you find your belly's growing, some positions might be difficult or uncomfortable. You might have some less lubrication. So the good thing is this is a great time to try some different positions, find your comfortable way, and also just keep your water-based lube close at hand. Lube's great for so many things. So you can get into that. Changes in the body. Sometimes mom feels less attractive, especially at the beginning of the pregnancy, because you don't look pregnant, you just look bigger. And moms think they look fat, and they don't look fat. It's just at that little time before the tummy actually starts to show, and a lot of moms feel very unattractive, and that's not what dads tell us. So just to know that dads they really like the pregnant body. So ladies, just know that you might think you don't look so good, but trust me, dad thinks you're a hottie, and if he could, he'd have his hands all over you. So just know that you're beautiful, and being pregnant is a beautiful time in your life. So, just enjoy that and know how gorgeous you are. You can also have alternatives to intercourse. So if you're feeling uncomfortable, if things are not going so well, this is really a good time to talk with your partner about alternatives. And one of the really nice things is non-sexual touch, non-sexual massage. And so for mom, a lot of times you're not sleeping good, things have come along, your feet are sore, and this might be a really nice time to get dad to give you some massages. And neck massage, your lower back might be feeling a little stressed, and your feet. So it's really nice to spend some time. This is quality time. This is still bonding. You don't have to have intercourse to feel the love and to feel how great dad is trying to help, and he really wants to pamper you at this point and make you feel good, because that's what it's all about. So also cuddles. Do lots of cuddling, lots of time with your partner now, because once baby comes, you don't have as much time together. So cuddles, spooning, and like I say, just lots of non-sexual touch. This is a really great way to stay connected with your partner. Postpartum. So we've had our little one has arrived, and so about the recovery time. Most doctors will suggest, whether you have a vaginal birth or a C-section, to give yourself at least 6 weeks to recover. You've got your stitches there, you've got your placenta wound to heal, and you're going to be so tired, mom. You're going to be up every 2 hours with your little one. So hopefully the first 6 weeks is not an issue for you and dad to just get used to your new situation. And a lot of dads, they're quite happy to see the 6 weeks on the calendar, and you come home and it's like, oh, what do you say? And a lot of times, just because your body might be ready, mom's mind might not be. So it's always good to have this discussion with dad ahead of times that, dad's all excited because mom's coming home and we get this time to be intimate tonight. And it's not always that mom is ready. So make sure that you guys have this conversation so that dad knows you're not pushing him away, but you're just not ready at this point. So, you're going to find other ways that are really good to keep connected. Expect changes. Things are going to be really different after the birth of your baby. It's not just two of you anymore. Your roles are changed. Before you had all this free time to focus on each other and chat about each other and, spend that time together. And at the beginning, it's all about the baby, unfortunately. All the talk is about baby and your whole life is around this new person. And so, it's a different role for a while. So just if you are aware of this, and if you have had lots of close times with your partner before birth, before conception, you really had all these great intimate times. You might have to put that on hold for a little while, but there's for sure other ways of connecting with your partner. And the first few months are exhausting. They're really exhausting. And that's a big thing that so many people are not aware of, that, they think that the minute they come home, okay, the baby takes a bit, but this sleep deprivation goes on for months. So, just be prepared that can really affect your mood for intimacy. And that's where the hugs and the cuddles and the love talk really, really are so important. Expect severe hormone changes right after the baby's born. Your body is going to totally have to change. It's now getting ready to make milk from your breasts, your uterine's contracting. So there's a lot of things that are going to happen pretty quickly. So that can affect how mom feels about her intimacy. There's a lot of moms who really don't want any kind of breast stimulation from dad. Don't touch them. Don't touch my nipples. They're just, they're just not feeling like a sexual part of you right now because they are so much for the baby. But your body will start getting back into the pre-pregnancy state. And when you're feeding baby, a lot of times you'll get cramping, which is the uterus contracting. And so that affects how mom feels too about, having time with dad. Mom's feet can be swollen. A lot of our moms that I go to at the beginning, their feet are killing them and they've maybe had some fluid retention, whatever. And the last thing they're thinking about is anything sexy. So this is the perfect time for dad to, again, get into the massages, really pamper mom and make her know that the intimacy is always there. It doesn't have to be just straight intercourse. Feeling physically unattractive. And this is a time when a lot of moms don't like how they look or how their bodies look, and it's so funny because that's not what we hear from the dads. The dads think that you are so beautiful. They're just so happy that you're with them, and it's such a beautiful time for them. And they think you are hot. Okay. So just so you know, these dads really do think you're beautiful. And so it's a little hard sometimes when you don't see yourself that way, but dad really does. He really does think that you're amazing. The other thing that can kind of interfere is a lot of fear. So if you've had birth with stitches, either vaginally or through C-section, especially vaginally, a lot of people are worried that it's going to be painful. Their first time to be intimate is going to be painful. It doesn't have to be. Just take it slow, lots of lube, like have the time, make it a date, like have dates. How were you at the beginning of your relationship with your partner? You didn't just jump into intercourse. You were really just really enjoying each other's company, getting to know each other. There's just so many different things that you can do to slowly work back into the love connection that you guys had before. So the increased worries and the exhaustion. Again, places that were pleasure spots for dad, which is usually the breast and, the vagina area. He might not look at it the same way at this moment. Those were his little special spots, and now he's got to share it with the baby. So that can take a little bit of time just to get over that and get back into the swing of being a couple again. You really have to work at staying connected. There's so many other pleasuring techniques than just straight intercourse. And this is a great time for you guys to explore different things, to be able to pleasure each other in different ways, and just feel close. That's the whole thing. It's great bonding just by being close together. Love talk, non-sexual touching. These are all really great ways to, get dad and mom back together. Tips for your first time. So the first time might be a little bit scary, but the most important thing is communication. You guys have to talk. And, like we say, sometimes the body's ready, the mind isn't. So you have to have this conversation with dad. You have to start slowly. And, it shouldn't really be expectations. If it works out tonight, then that's great. But if it doesn't, it's not a failure. You guys have had this time together, and you're going to work slowly back into the intimacy you used to be able to have together. I can't stress enough, water-based lube, it is going to be your friend for quite a while. So just get in the habit of having lots of lube close by. Last but not least, this is a really important thing, is to tell you, you need to use protection. Breastfeeding is not birth control. And there's lots and lots of babies that, surprise, we're here because parents didn't realize that mom can get pregnant right away. So just know that you've got to use your things that you may not like, but use contraception until you get to the point where you can get back into your normal birth control. I saw a couple of messages here. Scarring. Someone is asking about scarring to the vagina and the vaginal lips. And if there is some scarring, which possibly there will be, that does definitely heal over time. And sometimes one of the best ways to reduce pain from scarring is massage. So you can massage that area. You could use a lube yourself, or you can get your partner to use it. But it should not really be painful. Just know that intercourse after birth shouldn't be painful. And if it is, you really need to speak to your doctor about what is the issue and how can you deal with that. There's all kinds of different things that can help, but if you are finding intercourse uncomfortable or painful, that shouldn't be this way. Is there any other? Someone was asking about laser to reduce.
Something that we would probably have to have like a specialist talk about.
I think so, and I'm sure your gynecologist knows about all the up-to-date techniques and things that are there for you. So there's lots and lots of things. You're not out there all by yourself. There's lots of new things. There's pelvic floor exercises that help to get you back in shape. There's so many things. So be open at this time. Speak to your healthcare provider, speak to your doula, and speak to your partner. Most importantly, speak to your partner. Like, it was love that got you guys here, and bring the love back. So that's me. That's all of my words of wisdom. And I hopefully somebody got some little tips from this. And if there is any other questions that that you have, hopefully at the end of our little talk with everybody else, we'll be able to get to them. So thank you for your time, everybody. And I'm sorry, I didn't go on and on for too long. Okay, thanks.
No, you did a great job. Thank you. And I'm sure there's a lot of tips that people didn't know, and that's what we don't ever want to create fear. We want to be able to talk about some of these things to normalize it so that we can have a conversation and we don't have to keep things to ourselves. We can know that there's help out there. So next, we're going to hear from Jacqueline. Jacqueline is a financial planner and also does insurance and specializes in families. And so, we're really excited to have her here with us today. She loves to make complex financial concepts easy to understand. I can definitely appreciate that. Loves rewatching her favorite shows on Netflix or catching up on the latest tech shows. So what is a Netflix show that you would watch over and over and over again? Just pick one.
I'm so guilty of it, but it's Gossip Girl.
Gossip Girl, nice.
Showing a little bit of my age too.
That's okay. And so her favorite thing to do is trying new ramen restaurants or French fries. The French fries, yes. I can definitely hear, but the ramen, you can enjoy those. So
I probably love French fries as much as Sharon loves cookies.
Oh, well, that's a lot. Well, take it away and teach us about protecting our family's futures.
Thank you so much, Christy. And Sharon, that was great. I've learned so much, and I'm sure once I'm on my pregnancy journey, I will definitely be reaching out to you. But right now we're going to spend maybe 10-15 minutes talking about protecting your family's future. And the first thing we need to know, just like anything, is the basics. And we want to know about the different types of insurance that are available. You may have heard several different terms thrown around at you, like group life insurance, mortgage life insurance, whole life, universal life, accidental, and it goes on and on and on. But let me try to make it simpler for everybody. There are two types of life insurance, and it is term and permanent. That's it. And simply put, term life insurance provides you with coverage up until the term's expiry date. So you can often see premium changes upon every term renewal, but eventually that coverage ends when there's an expiry date. So insurances that fall within this category are group life insurance. So if you have benefits with your employer, or mortgage life insurance, the stuff that you get from your bank when you buy a new house. Now, the second type of insurance is called permanent life insurance, and it doesn't really take a lot of thinking to figure it out, but as you may have guessed, it covers you for your entire life. Whole life insurance is an example of permanent life insurance because it covers you for your whole life. So there's a lot of things out there that tries to make insurance a lot more complicated than it is. But I like going back to the fundamentals and who actually needs life insurance and why is it important. So I like doing this in a couple ways. So first off, think of all the financial obligations you have, whether it's something small like your everyday grocery bill, paying your car insurance, topping up the gas, or your larger financial obligations, maybe your rent, your mortgage, or even saving for retirement. Now, if you decided to take a 6-month break from making your payments and throwing that responsibility onto a partner or a family member, would that person be able to handle it all? What if it was for a year, 5 years? Now, what if you start adding childcare expenses on top of that? how long will your partner or your family members be able to handle that extra weight? And if you thought about it and your answer is, well, not very long, or eventually something's going to give, then you probably need life insurance. And the purpose of life insurance is not to make somebody rich, but it's to make sure that you don't leave a financial burden to your loved ones. And typically, when you're talking about relationships and couples who are trying to have kids, that typically falls on the responsibility of a partner or your family. So now we move on to the question that I get asked the most when I have clients who come to me and say, what is this life insurance thing about? Is why mortgage insurance and group insurance is not enough. So let's first talk about the mortgage insurance part. And what mortgage insurance really is it's designed to cover the cost of your house. So whatever mortgage debt obligation you have, that is the insurance that'll cover up until that debt obligation. But then you think, okay, but what if my partner doesn't want to pay off the mortgage? What if they could really use the money for something else that's more urgent at the moment? They don't have the ability to pick and choose when they have mortgage insurance. Also, think of kids. We have a lot of moms or moms to be today, and if you just pay off the mortgage, you still need to feed your kids, and hopefully you have many. Where's that money going to come from? So a lot of the times we find that mortgage insurance is just not enough for your daily living expenses, because what's more important, your house or your kids? I would think my kids. And then the second thing a lot of people question is, what about group insurance? Well, group insurance is a great benefit from your employer, but not a lot of employers have it. Or sometimes they only cover you for $25,000, which is typically not even enough to cover 1 year's worth of groceries or even rent. So having your own personal life insurance is a lot of times making sure that your kids and your family are protected, so that if the worst case scenario happens, you're not putting anybody that you love, your partner, your children, your family, in unnecessary pain when it comes to managing their financial obligations. But that's plain and simple.
Awesome. Thank you so much. That's so interesting. And I know it's something that a lot of people don't want to think about when they're having a baby. It's like, you're starting a life. You're not thinking about, the end of it. But I think it's so important that we protect our family, right? Like, we want to protect our family today, and we want to protect our families, if we're not here. And I know a lot of people don't want to do a will because it's almost like it makes it real. But the last thing you want is to leave your family in chaos because things are not settled. And, it costs a lot to, especially if someone passes away young, it costs even more to not have that person, because you've got a mortgage, you've got all of those expenses. So
Absolutely. Absolutely.
it's
And I
such
guess the one thing I did want to add is, with a will, a lot of people think it's all just about money. But what a lot of people don't realize is that in your will, you also designate who you want to take care of your kids. So when you don't have a will, the Ontario courts are the ones who are responsible for deciding that. And quite frankly, I can't even trust them to shovel the streets on time when it comes to a blizzard, let alone take care of my children or decide who gets to take care of my children. So you're right, Christy, it's very important.
Mm-hmm. Yeah. So, we need to have these conversations, and that's why I love this opportunity to have this to get us all together and bring us up these conversations that might not normally get brought up. And we are going to, as I said, we're going to be breaking out into breakout rooms a little bit later. So we can, anyone who has questions for Jacqueline, we can set you up to chat. So next we have the amazing Jessica Payne. I always call her amazing because she is amazing, and I love I love her. I'm lucky to have her. So Jessica is, what did I want to say about you, Jessica? Jessica became a doula before she even knew what it was. And I love this because, most doulas are born doulas, and her family asked her to be at births when she was ridiculously young.
15.
And 15 was how young she was. And so didn't know what a doula was at that time, but they knew that they wanted her to be there and support them. So I think that's pretty great. She loves to go camping with her baby Ween. So her baby Ween is a little Dachshund dog who is super cute. I love being able to have a dog without having a dog, which is nice. And so Jessica's going to talk about a really important topic as well. Is modesty in labor possible? So let's hear more about that.
Hello. So thank you for explaining what a baby wean is, because by just saying that, it sounds a little creepy. But yes, Daisy is my fur baby until we have human babies of our own. So what do I know about birth if I haven't given birth myself? Well, I have been going to birth since I was 15, but I've been a professional doula for 11 years now, and I've seen hundreds of people's births, and there's quite a bit that can happen. Just what Sharon was saying, this whole experience can be very unpredictable. So the first thing that we're going to talk about is letting go. So you know that song, Let It Go by Frozen that all the kids love. We have to apply this to birth as well. So let's talk about modesty and letting it go and what is possible. So the first thing that we're going to talk about is the mucus plug. And I know that the attendees that we have on here today are in whole different spectrums of knowledge of what this means and also stages of pregnancy. So I'm going to start out right from the beginning, but fast forward to how this makes sense with modesty. So a mucus plug, I'm going to pull out my puppet. This is my cervix puppet. Your cervix actually collects mucus and discharge as you're pregnant, and when it's no longer needed, as your cervix is starting to open, all of this discharge is removed. But it's not typically a one-time thing. Sometimes it is, but usually it's a progress. And as your cervix gets bigger and bigger, more and more of that discharge lets go. And over time, it turns into what we call bloody show, which can be red, pink, brown. And what it is, it's the cervix letting go of blood. So what a lot of people don't realize is it typically is quite a lot. So sometimes it can just be a little bit that you notice when you're wiping after the bathroom. But for most people in advanced labor, it's enough that you require, an overnight pad or diapers. So the reason why it's important is a huge sign that you're progressing, and you're progressing well, especially when you've got quite a bit. So your healthcare provider, your nurse, your midwife, your doctor are going to ask you questions about it, and they're likely going to want to see it. It's not gross to birth workers. It is a sign that you're progressing well. So don't be worried about, anyone looking at your discharge. Totally normal. And of course, you can stay modest with having the appropriate garments to make sure everything stays as dry as possible if that's important to you. But a doula tip, you want to let it go, just like Frozen. So sit on the toilet. The toilet is the place where we naturally think of letting go multiple times a day, and that will actually help with the discharge coming out as it needs to and letting your muscles do what needs to happen. So that's the mucus plug. Next thing on my list is the toots. So another word for farts or whatever it is that you call it. And a lot of people are surprised by this one. So as your baby, and I've got another puppet for you to make it more exciting. So there's not a whole lot of room in the pelvis, and your baby's head is going to take up most of it. So as your baby is moving down, what happens is your baby's head compresses against the colon. There's going to be some air in there. So as your baby is moving down, you are going to pass gas. Regardless if you were going unmedicated or you have an epidural, it's uncontrollable. So the positive thing is the lower your baby gets, the more sensations you're going to release or feel too, and it's another good thing. And to be honest, no one in the room cares if you toot, blame it on the baby. The other thing that we have to let go is poop. And I think everybody knows, or maybe have heard, that it's common to poop in labor. I would say almost all of my clients have pooped for a vaginal delivery with pushing. And the same thing with why you're passing gas. Baby's head is literally right up against the colon. So as baby's moving farther down, it's almost like, think of a toothpaste, right? So baby's head is pressing against that tube. There's always going to be some stool in there, and that stool is going to come out with pushing. Now, as birth workers, we get really excited about this when you are releasing stool, because it means you're pushing effectively. And when you're pushing with your vagina, it's the same muscles when you're pushing out stool. So it means that you're pushing effectively, which we need to happen. Now, I'm not going to lie, there are very few clients I've had over the years that have not been concerned in the slightest about poop. Most people, it's a fairly private event, and the only one that ever sees your bowel movements is generally yourself. So keep in mind that a birth worker's 9 to 5 typically involves this all the time, and they're going to help you feel comfortable. So there's not a whole lot that you can do. I've had clients over the years ask about, if I stop eating in labor, will it mean that I won't poop? Well, keep in mind that your body is going to hold on to solids for quite a few days. And I would not advise to stop eating for 3 days before you give birth, just so that you don't poop. So a little doula tip. If it's something that you're really concerned about, which is an A-okay thing to be concerned about going into this process, talk to your healthcare provider. Nurses and midwives are fantastic with discreetly picking up any stool that might be pushed through pushing and dispose of it. And this can be great if you're feeling that your focus might be shifted to something that you might be embarrassed about versus the goal, which is meeting your baby. So a big thing to keep in mind. Also keep in mind that everybody poops. Poop happens, and it's a good thing. So if you're pooping, it means you're doing it right, and everyone's excited that you're going to meet your baby soon. On to other things, your partner in Modesty. So a lot of partners that I've spoken to over the years are also concerned about seeing the birthing parent in maybe situations they've never seen before, and they're concerned maybe about it being more graphic than they would like. So for anyone that is a birthing age, I'm sure that you would have seen some interesting birthing videos in high school. I know that definitely did not lead me into doula work, the science of birth, or whatever it was called. It's not a good depiction, I'm not saying that word properly, depiction of what birth is like, because there's no emotional connection that you have to those people giving birth. It's just graphic. So keep in mind that when you are working so hard to meet your baby, there is an emotional level that you cannot prepare yourself for, and you cannot prepare your partner for either. So all of the weird things that you're going to do for the first time really go out the window. And my partner Christy and I were talking about this earlier. There's a level of birth amnesia that happens to everyone involved that has an emotional connection. Most people don't remember how long they were pushing for. Did I poop? I don't know. They don't remember those things. And it's almost like it's what did you call it, Christy? A capsule. It's a capsulated experience. So in that capsulated experience, you don't take it with you for every day. It's a one-time thing. But keep in mind that if there's things that you would like to be adjusted for Modesty between you and your partner, there's definitely ways around this. You can set up a lot of different strategies around pushing, laboring, if you want to have an epidural. All of these things can be adjusted to help with comfort strategies. And making sure that your brain is comfortable is a pretty important thing. And then moving on to my last point, who's going to be in the room? We like to talk about how it's always a birthday party for your little one. So it can be quite quiet with hospital staff if you're giving birth in a hospital, or even with midwives, right up until the end. So at that point, just to give you an idea, this can change, of course, based on the scenario and your place of birth and your plans. But there could be a doctor that comes in or a second midwife, depending on the scenario, a second nurse, which is going to be taking care of your baby, as well as potentially students. During COVID times, these are limited, but keep in mind that everyone's got a role. So everyone's there to help you and to help baby, and having conversations ahead of time around what makes you more comfortable is usually quite easily integrated into a lot of different situations. So yes, it is a medical event, but it's also a really big emotional event too. So it's important that we take care of your body, but we're also taking care up here. We want to make sure that, this is a positive experience for everybody. So can we be modest in labor? I'm going to leave that up to you to decide, but there is definitely some wiggle room here. Thank you.
I think the bigger question is, should we care about modesty in labor? That's the bigger comment. But for those of you who haven't figured it out, Jessica and I are in the same office. And if we both have the sound on the computer at the same time, then there's crazy feedback, which is why we had some confusion in the beginning because we were both muted. But it takes a minute to get that organized. But thank you for talking about all that important stuff, Jess. I like talking about poop. We shouldn't care about it. Everybody does it. So next we're going to hear from Lisa. And Lisa, what are we going to tell you about Lisa? Lisa loves to empower mothers to believe in themselves and their inner strength as women, which I think is pretty similar to all of us, and comes from a long line of nurses from her grandmother, mother, and aunts. So a big family of nurses, which is pretty exciting. And her favorite quote is, "Life is like a box of chocolates. You never know what you're going to get," from Forrest Gump. So Lisa, take it away and tell us a little bit about healing after baby.
Can you hear me? No. No. Unmute. You can hear me.
I can hear you.
You
Lisa.
can hear me?
Yes.
Oh, nobody else can hear me. So Tanika can hear me. Everybody else can hear me. Nobody else? Vanessa can hear me. Okay.
Yep, you're all good. Everybody can hear you.
Oh, everybody can hear me. Okay. Okay, healing after baby. What is it? So postpartum healing can be different for every woman. So the first 6 weeks of postpartum are considered a recovery period. But it can be to keep in mind that it's just a guideline, and every new mom is different. I'm not very good at speaking. Postpartum symptoms can be sore nipples, backaches, cramps, and sometimes perineal pain. The recovery can take anywhere from 3 weeks if you didn't tear, to 6 weeks or more if you had perineal tear. Tips for, see, you're going so fast. Tips for C-section. C-section. If you delivered C-section, the recovery to expect some pain. And with COVID-19, maybe a day or two in the hospital or less, depending on your situation. So with COVID, they're letting patients out a little earlier, and depending on what happens, they sometimes keep you a little longer. The recovery time is anywhere from 6 to 4 weeks to recover. And sometimes, depending on your stitches or what they do, can be a little longer. You need a lot of help with lifting and avoiding going up and down the stairs and assistance with the baby. Let the family help you and try and get up and walk at least the first 24 hours to expel gas and manage pain. Use laxatives to prevent constipation, because at least, like the first little while you'll be constipated. You'll have a lot of gas. So like with the surgery, it's best to get up and walk around. It's the best way to expel gas. With breastfeeding, it's good to use pillows to prop the baby up, or use the football hold to breastfeed. Pay attention to any unusual pain. You know your body the best. Redness or swelling or oozing around the site. Any feelings that are different, or you find that are not, not your body, or, you don't find comfortable, call your doctor. Where are we at? Tips for recovery of the perineum or tears. Are we there? Yeah. Tears can be first degree that heal naturally, or second degree that tears usually take longer. Taking cyst baths, 8 to 10 centimeters of water, pat and air dry, or you can use a blow dryer. That kind of feels a little good when you use a blow dryer. Using a peri bottle after using the bathroom instead of wiping, or padsicles to ease the pain. You can also use baby wipes or flushable wipes after bowel movements. On our YouTube sites, there's the YouTube Helping Hand channels. There's the perineal massage you can also try. And there's probably a lot of other stuff on there that you can probably try. You know your body best, and try to go with that. The most important thing to remember is just remember that at the beginning, you'll need a lot of help, and it will be easier for you to enjoy your baby asking for help, and being able to enjoy your new bundle of joy.
That's awesome. Thank you, Lisa. And, I do encourage all of you to take a look at our YouTube channel, because we do have instructions on how to do perineal massage. We have how to make padsicles, and all sorts of other things. And I think a lot of people are afraid of tearing. They're afraid of the recovery of a C-section. But I always tell people, if that was that bad, then we probably wouldn't have any other children. We would all only have one, and I have 3. So we do make it through. However, that doesn't diminish the importance of the healing process and knowing what is available. So now is a time that if anyone has a question that is kind of a general question that you think might apply to others, you can ask it now. But like I mentioned at the beginning, we are going to set up private breakout rooms where you will have access to one of us experts to ask your questions privately as well. So if you have a question and you'd like to ask the whole group, please feel free to unmute yourself. And if not, we can move.
Hi, this is Margot. I'm not sure if you guys can hear me.
Yes, we can, Margot. Hello.
Hi. I was just wondering about perineal, like if perineal massage or anything. I've heard of stretches can help prevent tears? Yeah.
So I always kind of think that anything that won't do damage or won't cause things to be worse is probably not a bad idea. So perineal massage has, if you want to find research that supports it, you will find it. If you want to find research that says that it does nothing, then you're going to find it. But again, it doesn't do any harm. And I find that there's a lot of extra benefits. So there's the obvious benefits of trying to help the tissue learn how to stretch. And I think if someone told me to do the splits right now, and they were going to give me $5,000, I probably would push myself and make myself get down into the splits, but I might not be able to walk very well afterwards. But if someone said to me, hey, I'm still going to give you money, but I'm going to give you like 6 weeks to get ready, you know, like I think if I stretched every day, maybe I might still pull something because not everybody is meant to do the splits, but I probably will have less damage. So I kind of think of it in the same way. The other benefits are that we can have a lot of fear around the sensation of the stretching, right? A lot of people, if they don't have an epidural, may feel that stretching sensation could be a trigger. And having that time to mentally prepare, I think can be very beneficial too. And the last benefit that I find to perineal massage is the fact that it's a little uncomfortable. So when you're practicing your breathing techniques and, you know, are you a meditation person? Do you want to visualize? Well, it's easy to do that just lying in bed relaxing. But when you're having contractions, it's going to be uncomfortable. And so it's a great opportunity to practice those things and sort of see, do you like picturing yourself on the beach or not? So, you know, that can be very, very helpful as well. So you can definitely check out the instructional video, and then keep in mind that pelvic floor physiotherapists can actually walk you through it. So as doulas, we're not going to be guiding you exactly how to do it on, you know, Zoom or any of that kind of stuff. However, physiotherapists can. So that can be a really great thing for you to learn how to do it yourself or to have your partner do it for you. But that's a great question. Thanks for asking.